we are starting to see young individuals in their 30s and their 40s who have no underlying condition that would predispose them to complications, who are getting very seriously ill, requiring intensive care.
In school, you hear about it in the history books. So when there was talk of this flu back in January, we didn't really think much of it. And then when it started in New York City, it became really real.
You know, being able to work every day was a great thing, but we became fearful.
Just the whole global part of it, just how many people are being infected and how many people we see come in for rule out COVIDs.
In my 43 years here at the hospital, never thought that we'd be dealing with a pandemic like that, to the magnitude that it has been, how it affected the hospital, the community, all our employees.
Never would have thought you would be putting on an N95 and a face shield before walking into a patient's room.
What are you going to do to keep your family safe? Because that's everybody's first thought. What are you going to do at home? Checking each other over, looking at our PPE, making sure everything looks right. But inside, you know, you're scared.
As a mom of 2 little kids, we had a lot of discussions, washing our hands, why we have to stay home from school. We had a lot of difficult conversations.
I think I've actually cried every day during that time. Just a feeling of sometimes helplessness that we were, you know, losing a battle. We had a patient that, you know, was one of our great successes, but I remember when he came in and the first time we tried to FaceTime with his family, and he said that I loved you to his family members. Again, I lost it. I guess the emotion was just, we are so ingrained in the families' lives. Every day you're calling them, you're talking with the families, you know, trying to provide hope, but at the same time, you know, things can be just so catastrophic.
As a physician, you know, you're always prepared to deal with unexpected situations, but those situations last for 24 hours, 36 hours, maybe a week. When you are in a pandemic, then you are continuously dealing with a disease which is completely unknown. Your personal life is at risk, as well as your relative, your friends.
Once we understood the pandemic was occurring, the team came together in exemplary fashion. It was almost natural, quite frankly, us looking out for the community's safety first. The team pulled together swiftly and increased bed capacity by 50% at both hospitals, essentially creating COVID hospitals at each site.
We put together our emergency command center during the onset of coronavirus to meet the regulations of not only New York State, Pennsylvania, and the federal government.
Every day we had meetings. Every day I'm trying to update my staff.
Nobody hesitated. Everybody just knew they had a job to do. We followed all the policies and protocols that were put in place. If we felt like something, you know, needed to be adjusted, or we felt, you know, when we were doing this that something could be done better, we, you know, brought it up to each other and talked about it.
You know, we have a morning meeting every day. This is what they want us to do now, because things are changing so fast.
I work in the nutrition department, so we just had to take some extra cleaning steps and then some other things for patient meal trays. But I think we all came together and we knew what we had to do for everyone to make sure the patients were safe.
As a healthcare community, we really tried to reach out to our local community and keep them informed of what was going on. I know me personally in my practice, we did a lot of communications about the testing and different phases that we were going through to try to keep people informed and safe. The hospitals actually reached out to business owners as well as other community leaders, tried to make sure that everybody was aware and knowledgeable of what they needed to do to take care and be safe.
The community's involvement was extremely important, and we could not have made it through without the community support. We had meals being delivered on a daily basis. We had physicians coming together, willing and able to help in any area possible, from event management to help with policy and procedures to help with communication. Physicians in anesthesia and the ED coming up with out-of-box and innovative ideas to treat patients. And then the community support in terms of communication. We just really came together with their help, and I feel like we were able to respond and give them some help too.
It was humbling to see the response. They're out front in their cars, you know, doing little vigils for us. They painted little rocks and lined them along the sidewalk. Food constantly, they just fed us and fed us.
We received multiple, if not daily, donations of cloth masks, regular personal protective equipment, N95 masks, cotton masks, disposable masks, and it was just an overwhelming support from the community.
We've had donations from Pepsi, Bimbos, Girl Scout cookies, Friendship Dairy, Rafi's Platter.
The Bradford era had pictures, and they were all about us and what we were doing, and you had to kind of pull the town together and know that we were assured of ourselves, you know, to let them be a little bit more relaxed.
I have always said that I'm proud to work here, but honestly, during this hardest time, I've even been more proud, and it has a lot to do with the work that we're doing, but also the coworkers that I have.
It just overwhelmed me how the staff drew together, and we supported each other. They supported me as much as I supported them. And honestly, our relationship seems like a big family now. That's the good that has come from the pandemic.
I'm proud every day as a healthcare professional, but I think we've taken this by the horns. I think we've done everything we're expected to do. I think the community sees that. I think they look to us as role models, and we're doing our best to take care of their loved ones. You know, it's different now because they can't visit like they used to. So they're relying on us to be there for their family members as well. And I'm really proud that we are.
Having the support of the people that I got to work with was amazing and was probably one of the greatest gifts that I've ever had. It was something, you know, unlike, I don't think that people outside of our hospital community could really understand what we went through. Every staff member, you could not find a single staff member that was not participating in some major way during this crisis that we had. And I think that although we're small, we were quite mighty.
I want to thank all the physicians, nurses, entire staff of Olean General Hospital, Bradford Regional Medical Center, the community, the EMS community, for all your exemplary efforts preparing for a pandemic. It was an unbelievable performance, and quite simply, you saved lives. Thank you.